Our topic today, the heart attack. Welcome to International Academy Germanische Heilkunde by Dr.Hamer, MD. My name is John Holledauer. At GHK Academy, I am responsible for representing the original seminar program, according to Dr. Hamer, in the English language. With the heart, we are at the classic heart attack, pulmonary embolism, circulatory failure, palpitations, atrial fibrillations, and pericardial effusions. Let's start with the classic heart attack. The brain relays are located in the right territorial area, and here handedness is decisive. And the hormonal status plays a significant role. Therefore, we have associated conflict content with the territorial areas, always two possibilities, either male or female perceived. The handedness determines whether the hammer's focus strikes in the right or the left brain hemisphere. The male perceived conflict is the male loss of territory. For example, the man loses his job, or his house and yard, or if the woman runs out of his territory. However, the boy can also react with this loss of territory conflict. For example, if the mother divorces and leaves the family. For the boy, the mother is part of his territory. If the man is right-handed, the hammer focus strikes in the right in the territorial areas, in the relay for the coronary arteries. The female counterpart is the female sexual frustration conflict. For example, when the man says to the woman, "I don't want a child from you at all," so frustrated in her sexuality. Or if the woman catches her husband in flagrant, "Why does he sleep with her and not with me?" Of course, the rape would also be a sexual conflict. But also the girl can suffer sexual conflicts, for example, if she catches her parents making love, or the exhibitionist, or the children playing doctor, if they are caught and confronted by the adult. "You piglets, who started this?" If the woman or the girl is left-handed, then the hammer focus with the so-called night hop also will strike this brain relay. In both, in the right-handed man and the left-handed woman, the same SBS of the coronary arteries is now started. Although in the male and in the female, the same relay on the same SBS of the coronary arteries is now started. There's a essential difference between man and woman, which is in the crisis itself. This SBS is actually only crucial for the man, because in nature, the man who has lost his territory is no longer responsible for reproduction. However, he no longer even desires to. With this active conflict, the libido of the right-handed man is in the basement, thus he has no more sex drive. On the other hand, the left-handed woman becomes depressed with this active conflict, and thus she becomes super feminine. Now we come to the special program. In the active phase, the squamous epithelium of the coronary arteries ulcerates, which is also a biological sense. By the ulcerative widening, now more blood gets to the heart muscle. One gets, so to speak, the turbo kicks in order to easier reconquer the territory. The squamous epithelium of the coronary arteries belongs to the so-called gullet mucosa pattern, and this hurts in the active phase. So here you have angina pectoris, heart stabbing. If this territorial loss can be solved, angina pectoris will be gone immediately, and the coronary vessel will be repaired under swelling. It is even possible that the coronary artery is closed completely, but this is not the cause of heart failure. In the crisis, as always in the squamous epithelium programs, we have the absence. The crisis in the gullet mucosa pattern is extremely painful. So in the crisis, one has again very intensive angina pectoris. From the brain relay, fewer signals reach down to the heart, and therefore we have arrhythmias. Now, there is a difference between man and the woman. With the right-handed man, with the conflict active for more than 9 months, no signal at all gets from the brain to the heart, and this is the heart failure, the cardiac arrest. The right-handed man will die. The left-handed woman, even with a conflict load of many years, the left-handed woman survives the crisis, which is the heart attack. The reason is, if the man needed longer than 9 months to reconquer his territory in nature, Mother Nature says, you are no longer the best, so for reproduction, you drop out. In nature, only the best of men, only the alpha is allowed to provide offspring. And before you start to make trouble in the pack, Mother Nature takes you out of the race. But all women are supposed to have children. Thus, the woman does not die of heart attack. After the crisis, the swelling on the coronary vessels subsides and the blood vessels opens again. If it remains stuck, natural bypasses will be formed. Attention! The assumption that the occluded coronary vessels causes necrosis of the heart muscle, which prevents the signal from reaching the heart, is wrong. The heart muscle, also called the myocardium, has its own special program, which I will explain in a separate video. To summarize, thus, the heart attack is purely a brain symptom and have nothing to do with the coronary arteries. I explain this in more detail in the seminar tutorial about the heart. In the crisis you have the absence, severe angina and arrhythmias. The conflict may not be resolved in a man with a conflict load of more than 9 months. Case study. Dr.Hamer shared the following patient case with severe angina pectoris in his seminars. A real estate agent purchased his dream house. Now all that missing was the perfect dream woman, who he found soon. But this dream woman does not and would not become pregnant. The doctor said it would be because of her ovarian cyst, which of course was nonsense. Women with ovarian cysts are more feminine and looks much younger than women without ovarian cyst. Therefore also the dream woman. However, the broker wanted children at all costs, so he divorced this dream woman. The neighbor already had an eye on this dream woman for quite some time, and indeed, the dream man moved in with the neighbor. But this was not the conflict for the broker. But one day he saw his ex-dream woman pregnant. Boom! That was his loss of territorial conflict. 5 years ago. The broker desperately says to Dr. Hamer, "What should I do? In the meantime, she have even 2 children." Says Dr. Hamer, "I advise you to walk by the neighbor's house every day and get annoyed. Stay active with this conflict. If you solve this conflict, you will die in a heart attack." You see, dear students, sometimes therapy in germanischer Heilkunde also means not solving a conflict. The patient have nothing to benefit from resolving his conflict, but then not surviving the crisis. A final suggestion: if possible, study Hamer always in the original. Have fun with your studies. I see you in the following video. Goodbye.
Germanische Heilkunde is considered by those who have understood its underlying principles to be the most significant discovery in known human history. While conventional medicine is based on more than 5,000 hypotheses, Germanische Heilkunde can be proven at any time to be the only medicine that is scientifically verifiable. With Germanische Heilkunde, for the first time in recorded human history, there is a scientifically verifiable medicine for each patient case. More than 30 medical universities have already confirmed this in the past. Still, Dr. Hamer's discoveries have been suppressed and denigrated for over 40 years. Take your health into your own hands and learn Germanische Heilkunde while you are still healthy. For this purpose, the GHK International Academy offers you an extensive program of seminar tutorials from the basics through the organ level to the psychoses. This seminar program will change your relationship with your body and your health once and for all. You will find the direct link to the homepage of the GHK International Academy below the video.